Every now and then, I have a conversation with a patient that honestly pisses me off because I feel like they've been given very, very bad medical advice and they are going to spend the rest of their life taking a medication they don't need to take. Now, in this video, I want to share what I think is the most painful lie of conventional medicine that frankly causes or allows the vast majority of diseases to flourish and for people to just take medication until the day they die. Now, in this video, we're going to talk about what I think is the most powerful healing principle you need to keep in mind if you think that taking medication to the day you die is unacceptable and you feel deep down there is a fix to the symptoms that you have. Hey guys, I'm Dr. Alex Heyne, board licensed doctor of acupuncture and traditional Chinese medicine and author of the health book Master the Day. So let's jump in. Now, I had an uncomfortable conversation recently where I was at a conference and I was speaking with a friend who was recently diagnosed with stage 2 hypothyroidism, Hashimoto's. And what she said to me was that, she went to UCLA Medical Center and she saw her endocrinologist. When she asked, is there anything that I can do or anything I can prevent it or anything we can use to treat it? She said, well, no, there's nothing that will change your antibodies. There's nothing you can take to treat it. There's nothing you can take to prevent it. You could try a gluten and dairy-free diet, but it's just going to get worse over time. The thyroid antibodies numbers never get better. And basically, you're just going to have to let the thyroid be destroyed until the point where you need thyroid medication. And that's my recommendation to you. And the more she pressed her endocrinologist for answers as to what she could do to maybe prevent this, the more she was not only told, we don't know, she was told there is nothing. This really solidifies a reason why I am in this profession and why I did not become a typical medical doctor is because the greatest lie in the world, in my opinion, for the majority of the day-to-day internal medicine issues is that there are no fixes. That you just take this PPI for your acid reflux forever. That you just take this anti-anxiety medication or antidepressant forever. Because there is no other alternative. But that's a lie. Now I want to share some of my own patient case studies here that were told what I call the greatest lie. And I'll share 3 women here that I've worked with because they were excellent case studies regarding they were told by medical doctors that XYZ was not treatable and I functionally reversed all of them with traditional Chinese medicine formulas. Now, the first case study is a young woman named Alyssa. Now, Alyssa comes from a family of doctors. She's a doctor herself, dentist, went to dental school, and Alyssa came to me when she got a very, very bad pap smear. So the pap smear had revealed that 2/3 of her cervix was covered in precancerous cells, strongly correlated with the development of various kinds of reproductive cancers, but cervical cancer down the line. She was recommended to get something called the LEAP procedure, and if you want to be horrified and have nightmares, Google LEAP procedure for cervical dysplasia, where they basically electrocauterize and cut off the top layer of the cervix because their thinking is it's a structural problem. The cells had changed and now these are precancerous. So if we just cut off the layer of flesh where the cells are, then let's just see what happens. And she was told for her gynecologist that she would need to do that multiple times for sure, and that it would have an unknown effect, but there would be an effect on her fertility. She was 26 when she came to see me and she wanted children, so to think that she could potentially not have children scared the ever-living hell out of her. Now, Alyssa came to see me because she had been referred by another patient. And what I told her is I've seen internal medicine formulas treat this, and I would recommend you allow me to treat you for 6 months and then get another pap smear and then we can reconvene and see what the results are from there. I can't make any promises. I can tell you I've seen this before, treated. Now what happened was I treated her for about 4 months with an internal medicine formula from Chinese medicine. And after that period of time, she had relocated to a new job in another state and she had a new gynecologist that wanted to do another pap smear because she was considered pretty high risk. She got a new pap smear and the pap smear came back 100% clear. 0 sign of precancerous cells. Her career gynecologist said in 30 years, they had never once seen that happen and had never once seen that happen in that fast of a period of time. And what I wanted to say was, yeah, no kidding, Sherlock, because we treated it. I don't think any doctor in the world would tell you that was treatable. No medical doctor or gynecologist, but it is in my profession. Now let's go to another patient of mine, Julie. Julie was a clinical nutritionist and a trainer who had lots of acid reflux and lots of anxiety. But when we shot this case study in her living room, what was most telling was that she ate a very healthy diet, but she loved coffee and she was easily stressed. She had high stress in her life. And she had gotten clinical certifications for nutritionists, and she was told adult onset food allergies are not reversible. To a T. The peppers she ate that caused acid reflux, the tomatoes, the Italian food, not reversible. And yet, right here in her case study, we treated her for 3 to 6 months. All of her upper GI issues completely went away. Reversible. her food allergies and food intolerances. The third woman here is a woman named Monique. Now, Monique had never had a menstrual cycle in her entire life since she started menstruating in her early to mid-teens. When she came to see me, she was in her early 30s because she had gone a very long period of time on birth control for these irregular menses where she just wasn't menstruating at all. I had treated her for about a year with internal medicine formulas for her hormones. Over the course of 12 to 16 months, about a year and a half, she then had a monthly menstrual cycle with her other cystic acne and bloating that went away, and she had a healthy baby very, very recently. There's no doctor that would have said that's ever fixable. The woman had never had a menstrual cycle and then was on birth control for like a decade and medications for that. And then we used a Chinese formula and she had a monthly menstrual cycle the first time in like 35 years. So a lot of people believe the world's greatest lie, that their condition is not treatable. Whether it's gynecological or precancerous, or it's acid reflux and food allergies, or it's irregular menstruation, that you need to have birth control for your bleeding or irregularities. And the good news is, usually that's not true. Now, something I want to emphasize here is that doctors are not bad. They just know what they know, and they don't know what they don't know. You know, there's a very logical question to ask, which is that if alternative medicine and traditional Chinese medicine work, why don't doctors use it? I mean, there are whole books written about this topic, right? Bias, profit, the ability to patent certain things. You can't patent herbal formulas. So if alternative medicine and Chinese medicine works, why don't doctors use it? Honestly, it's just as simple as it is a system teaching them a specific way to treat things. If they are taught no herbal medicine can ever possibly treat cervical dysplasia, then they don't believe that, and they tell their patients that by the thousands per year. It doesn't make them a bad person. They just genuinely believe that what they are doing is the most evidence-based and is the only thing that actually works. So when they tell you there's nothing else you can do, personal opinion, I wouldn't believe that. I would get a second opinion or a third opinion, or talk to this guy right here, because I'll give it to you straight. Now look, my story is a great example of this. My GI that I saw for IBS and severe constipation and SIBO and bloating, he wasn't a bad person. He just legitimately thought that what he recommended to me, the medications, the colonoscopy, was the most evidence-based care for me. Now, and it was the most effective care. Now, that wasn't actually true, but he didn't know that. He has no training on integrative or holistic medicine of any kind, right? He probably sees 200 patients a day and literally says the same thing. Get a colonoscopy, endoscopy, take this medication, take that medication. So what he gave me wasn't true, but he didn't know that, right? I had to go through this chance-based encounter, whether it's destiny or fate or God was guiding me to a cafe where a guy told me he was really sick and he stopped seeing his doctors and he saw a Chinese medicine practitioner nearby that didn't cure his illness but got him the best symptomatic relief he'd ever experienced. And he went to famous clinics. And when I saw this guy, he gave me a very basic herbal formula that didn't require a lot of skill to give. And when that got me the best bowel function of my entire life, I very immediately learned, one, I could never go to medical school anymore, and two, there are alternatives that work, but you'll never hear about them from your doctor. Now, that's my long impassioned rant for today, guys. Often, it's hard to know how to fix symptoms, though, if you don't know where they're coming from. So I put together this free quiz below this video. It's just dralexheyne.com/quiz. And that quiz goes into a little scoring system for you looking at your symptoms, where they're coming from, and we actually break down, even if your labs look normal, what organ system you might want to consider treating. Like, is it the gallbladder? Is it your liver? Is it your small intestine? Is it your lungs? And then it actually breaks down the exact videos we've shot on helping those conditions. So check it out right below this video here. And if you want to work with me one-to-one in my clinic in Los Angeles or virtually via telemedicine, I work with a very limited number of new patients. And this is for those of you who are tired of the protocols, the supplements, the same exact things being given to you, medications for life, the irreversible surgeries, and you want to get to the root cause. So if that's where you are in your healing journey, you can go to dralexheyne.com/clinic or check out the link right below this video, as well as the phone number. Give me a call or book a free consultation, and we can discuss the best plan to help you solve the root of the problem. One final thought here, I have another great related video on specific herbs that will help with healing symptoms right here.